Right, to tune into the South African morning right here on ENCA channel 403. Let's get into some of our COVID news now. Discovery Health says that a third of the country's COVID-19 survivors may be at risk of reinfection. Well, this estimate is based on a recent antibody study done by universities. Well, more than 1.5 million people in the country have tested positive for COVID-19. Discovery Health CEO Dr. Noach says that the country is moving towards herd immunity. What does this mean? Let's unpack this even further. He joins us now from Johannesburg. Dr. Noach, thank you for your time. Good morning to you. Now, I saw your presentation and read about it in terms of, 55% at least of South Africans or people in South Africa having tested positive for COVID. This, of course, coming from antibody testing done by universities as well as blood banks. What does this actually mean?
Well, there's two elements to this assessment, and good morning and thanks for having me. The first is a mathematical element, in fact, a calculation based on the South African Medical Research Council's excess deaths report. If we take the mortality rate of COVID-19, based on the Imperial College studies and the population or age-adjusted population mortality rate for our country, our mathematical actuarial calculation gets us to a COVID-19 infection rate across the country of about 55%. Now, that sounded high to us, but what gave us confidence in this mathematical assessment is that the South African National Blood Service, also the University of Cape Town and the Cape Town City Metro have done antibody testing around the country, and they are finding very high antibody levels in their tests, approximating 50%. And so with the convergence of the mathematical model and these antibody tests, it does seem like a likely penetration figure.
All right, so when we talk about then the risk of reinfection comes to play here, does it not undermine then the concept of herd immunity?
Well, it could possibly. The reinfection data is worrying. We took our members who were infected in the first wave of COVID-19 during the middle of 2020, and we looked very carefully at that same cohort of members who were then infected again during the second wave at the end of 2020, early 21. And what we see is that about a third of the members who were infected in the first wave are susceptible to reinfection a second time. Now, the question is whether this relates to a variant that is escaping immunity from the first time, or whether, in fact, COVID-19 immunity just doesn't last. The immunity wanes over a period of time, and then this third of people are susceptible to reinfection. We don't know that answer, but with new variants around the world at the moment, it is certainly a concern, should a third wave materialize, that there will be a high reinfection count.
Right. And with that being said then, just for clarity's sake, according to Discovery Health data, how many are actually at risk? How many survivors, that is, are actually at risk of a reinfection?
Well, our data shows that a third of the people who contracted COVID-19 in the first wave were susceptible for reinfection in the second wave. There are complex models behind this. Doesn't mean 1/3 automatically caught it in the second wave. We have to work out an exposure factor. But based on the exposure factors that we calculated, it's about a 1/3 reinfection rate of the second wave on the first wave in the South African experience.
Doc, I want to talk about mobility data here just for a second. And I'm gauging here from, the 2020 festive season all the way to the 2021 Easter, weekend and Easter holidays. When we look at human behavior as well as movement, what does that data particularly tell us about, the impact of a potential third wave, do you think?
Well, importantly, at the advent of the second wave, we saw very high mobility across the country. This was a large amount of interprovincial travel, particularly down to coastal regions. And that, together with particularly the post-matric festivals, these super spreader events seem to actually trigger the second wave. So we were particularly concerned about the Easter period and mobility associated with the Easter period as a trigger for a super spreader event in the third wave. Whilst we did see mobility increase around that Easter period, the increase was nowhere near the same spike that we saw during December. And I should qualify this and say we use Google's mobility reporting.
Right.
They provide an index of mobility around the country. And so the mobility was certainly up during Easter, but not up nearly as much as it was pre-December holidays. And we think that's a good thing and could have protected us against an earlier third wave. Although clearly at the moment we're particularly worried as we see infections on the rise.
And with that being said, just briefly before I let you go, then what's the strategy from Discovery in vaccinating at quite an urgent rate?
There is no more important initiative at the moment. Nothing more important than a high-velocity vaccination campaign. We need to reach the elderly and the at-risk members first, urgently, and we need to make sure we vaccinate those people all over the country to protect them from the severe consequences of COVID-19. And of course, we're seeing from evidence emerging from countries around the world with advanced vaccination campaigns that not only do the vaccines prevent severe disease, they also prevent new infections. The number of face-to-face or person-to-person infections that emerge post-vaccination is substantially lower. So this is by far the biggest public health priority at the moment. We're ready at Discovery Health to commence with the mass vaccination campaign on the 17th of May. This is the date communicated by the Department of Health, and we're hoping and anticipating that the Department of Health will start distributing its vaccine supplies that it has procured for the country.
All right. And with that being said, have you started coordinating some of those plans?
Yes, we've built our first 5 vaccination centres. They'll be ready next week for the commencement of that campaign. We depend on the central supply of vaccines from the Department of Health. We're working very closely with them. The stock has landed in South Africa, and so we're holding thumbs that we get that supply from them and we can kick off the campaign. And I know many other entities like Discovery Health all over the country are preparing for vaccinations. The whole retail sector of the private healthcare sector, which is a very efficient pharmacy infrastructure, is preparing. And then, of course, in the public sector, there are a large number of sites already administering vaccination through the Sisonke trial, and those sites are ready, willing and waiting to receive their supplies.
All right, Ryan Noach, pleasure talking to you. That was Discovery Health CEO, Dr. Ryan Noach, talking to us there with some of the plans they have in place, of course, to support government's plans for vaccination.